Okay, so the first thing we want to do is we want to put our BSI or protective equipment. We want to determine if the scene is safe. It is safe. There's nothing impeding me to take care of her. We want to determine the mechanism of injury. From our phone call, it was reported that she fell from the second story, so fall. We want to determine if there's any additional EMS we need a request. It doesn't look like it. We just have one patient. We want to consider stabilizing the spine since we might be afraid that she may have some sort of spinal problems. Or for primary assessment, we have to determine the level of consciousness. Miss, can you tell me your name?
Jen.
And can you tell me what happened?
Yes, I was pushed out of a second story.
You were pushed? Okay. Do you know by who?
Yeah, my boyfriend.
Your boyfriend? Okay. What's your main complaint? What's the
My
most
legs.
bothering thing?
They really hurt.
Your legs
My
really hurt? Okay, so we want to move on to ABCs. So she's speaking to me, so I know that her airway is open. So we can see that her neck is in neutral position. We want to, if we have a stethoscope, we want to use that in here for breath sounds. Okay, take a deep breath. One more time. One more time. Lung sounds are clear and equal on both sides. Now we want to determine circulation. We want to palpate the carotids. I feel a pulse. You want to palpate the skin to make sure it's nice and warm. You want to palpate the radial. Okay. Yes, she does have a pulse. From there, now we have to move on to our history taking. There's no one else here to tell us more about what happened. So now we have to move on to our secondary assessment. We want to palpate the head to determine if there's any bleeding, if there's any bruises from stuff. Tell me if that hurts.
No.
If that hurts, you want to palpate her ears, her nose. Can you open your eyes for me? And if you have a pen light, you want to determine if the pupils are reactive. They are reactive on both sides. I didn't see any blood. We want to move on to the neck area. It looks like it's symmetrical on both sides. We were able to feel the carotids, and we can see the jugular veins. Now we want to move on to the chest area. We have already assessed the chest, but we still want to make sure that it's equal on both sides. So yeah, so for chest, we can see her chest rise up and down. Now we want to move on to the abdomen. We want to inspect the abdomen first, and then we want to palpate. So we want to check for any tenderness, and okay. From there, we want to move on to the pelvis. Let me know if anything hurts, okay? So you want to just palpate for any, for symmetry and to see if you can determine any anatomical problems, okay? Now you want to move down with inspecting her legs. So now you want to inspect each extremity itself. Let me know if that hurts, okay?
Ow.
It hurts right here?
That really hurts.
Right? How bad is your pain?
Like the worst pain ever.
The worst pain ever? Does it radiate?
Yeah.
Where does it radiate to?
All over my leg.
All over your leg? Okay, now you want to use this other leg.
Ow.
Where does it hurt? Right here?
Yeah.
What about here?
Yeah.
And here?
Yeah.
It
Yeah.
does?
It
Here?
hurts. Yeah, really bad.
And here?
Yep.
It does? Here? Now we're down here, we also want to check for pulses down here. Let me know which feet am I touching?
My left foot?
The left foot?
I can't feel anything.
You can't feel that?
Nope.
Okay. Now you also want to check for the skin. Now you want to come up here to the arms. Okay, let me know if Doesn't hurt?
No.
Okay. So we have determined that there's pain in the lower extremities. So we want to splint both legs since they might be broken or fractured. So there you go. We want to get some vital signs. We want to get some blood pressure. We want to take her pulse, her respirations, pain level, and we want to splint. Like I said, we want to splint both legs to prevent any further injury to our extremities. And then for her, it seems like she went through a major trauma, so we want to reassess every 5 minutes.